Come in.
Hi, I'm gonna be Keith. I'm gonna be your nurse today. So what brings you all in?
Are you okay? I think she's a little nervous about being with a male nurse.
Okay.
Is it possible for us to switch out?
Oh yeah, of course. I'll go see if I can find Brandy to be your nurse, all right?
Okay, thank you so much.
You're welcome.
Don't take it personal. It'll be okay. It'll be okay. Come in.
Hi guys. How are we? My name is Brandy. I'll be your nurse today. Is that okay? Yeah. Okay. Perfect. So first off, can we just verify your name and date of birth for me?
Yes, my name is Rebecca Hendricks and my date of birth is 1/2/14.
Okay. Perfect. So Mom, can you please tell me what brings you guys in today?
So for the past 3 days, Rebecca has had some pain when peeing and has had some loss of appetite.
Oh, I see. I'm sorry to hear that. I see you have noticed those symptoms. Do you have any other symptoms?
Yes, she has actually been peeing a lot more frequently than usual.
Okay. Have you noticed that Rebecca has a fever or is vomiting or suffering from any lower back pain?
No, I don't think she's had any of those problems.
No? Okay. Rebecca, let's take your temperature. Can you open your mouth, please? Beep, beep. Okay. Your temperature is 98.6 and it's within normal ranges, so that's a good thing. Rebecca, do you take a lot of bubble baths?
Yeah, I take maybe 3 to 4 a week.
Oh, okay. So can you also demonstrate for me on the doll that you have, since you brought it with you today, how you wipe after you use the restroom? You can use these wipes here if you'd like.
Thank you. So normally I wipe from back to front.
Okay. So we see these symptoms quite often in girls' moms, so no worries, right? So I see areas of improvement with what you've seen or what you showed me. So we want to stop her from taking bubble baths because the baths, which have perfumed soaps, can have cause irritation. And then have her take showers instead. I know it's not as fun, but it will help with these symptoms.
You can do that, right?
Yeah.
Okay, we'll do that. And is she wiping correctly?
So I'm glad you asked. We want to make sure she wipes from front to back so as not to introduce bacteria to that area. This is the correct way that you want to wipe.
Okay.
Let me just use the same
Sure.
little, I'm gonna borrow
yes.
that as well, you know? Okay, so we also want to make sure that she's wiping from this area all the way back, okay? That way anything from the back doesn't introduce into the front, okay?
Okay.
Here you go. Thank you so much for letting me borrow her.
Of course.
She's very nice and beautiful.
Thank you.
So the doctor will probably request a urinalysis on Rebecca to see what the cause of her symptoms are. Is that okay? Yeah, okay.
Yeah.
Okay, so Rebecca, you'll need to pee in the cup, and then the doctor will run the tests. And then before he comes in, Mom, I just want to remind you to have her drink plenty of fluids, no bubble baths, wipe from front to back, and to pee when she feels the urge, or at least every 3 to 4 hours. Do you have any questions?
I don't think so. Thank you so much for all of the information.
Thank
You're welcome. I hope you feel better, okay?
Thank you.
Okay.
Hello. My name is Deanna and I will be your nurse today. Can you verify your name and date of birth for me?
Sure, my name is Daria Becker, and my date of birth is February 7th, 2009.
Daria, I see you have been scheduled for a kidney transplant for your kidney failure, and your mother here will be your donor as her antibody cross-match test has come back negative. I am here to talk with you both about the upcoming surgery and answer any questions that you may have. How are you both feeling today?
I'm all right, but I feel a little scared and about the surgery.
Yeah, I too feel anxious and nervous about the procedure, but I'm happy that I can help my daughter live a longer life.
I hear from both of you that you're nervous and afraid for this procedure. I hope we can discuss these concerns and help calm some of your worries. The doctor has gone over Daria's blood work and x-rays, and the surgery has been approved. During this time until your surgery, you both should continue to eat healthy, keep all of your medical appointments as scheduled. And Daria, it's very important that you continue to take all of the prescribed medications at this time.
The doctor mentioned that Daria will be on medications after the surgery. Can you tell me why she would need to continue medications if she's getting my healthy kidney?
Great question. The doctor is correct, as Daria will be on immunosuppressants following the surgery. These immunosuppressants will help Daria's body from rejecting the kidney. Without these medications, Daria's body will likely not accept the kidney. It is important that Daria takes all of the medications as prescribed and follows up with her providers as scheduled. Along with the medications, Daria should stay away from big crowds and anyone who may be sick due to immunosuppressants that she will be taking. To help the immune system, it is also important for everyone to perform hand hygiene correctly and frequently. I know this is a lot of information, but we will be here to help you along the process. Do either of you have any additional questions for me or the doctor?
No.
No, thank you.
Come in.
Good afternoon, Ms. Jenkins and Keith. My name is Latoya, and I'll be your nurse today. How are you both, and what brings you to the pediatrician's office today?
Mommy, can you tell her?
Sure. We are here today because Keith has started wetting the bed again. I'm very concerned that this is diabetes, and his father becomes upset with him in the mornings.
So you're concerned that Keith may be diabetic and your husband gets upset with him in the mornings?
Yeah, I'm just worried.
When did the bedwetting start?
About 2 months ago, about the same time as the new baby, Regine.
Oh, you have a new baby?
Yes.
Okay. So have there been periods longer than 6 months where Keith did not experience bedwetting?
Yes, ma'am. I was waking up in a dry bed every morning. I don't know what happened, but this is crazy. I'm so embarrassed.
Okay. So we call this enuresis, and there are two main types, which are primary and secondary. It appears that Keith is experiencing secondary enuresis because the bedwetting has returned after a period longer than 6 months without bedwetting. How often a week does Keith wet the bed?
He wets the bed about 2 to 3 times per week.
Okay. Keith, does it hurt or burn when you pee?
No, ma'am, but I'm just so embarrassed that I'm wetting the bed. I don't know what's going on.
Ms. Jenkins, has Keith had any problems with bowel movements? Can you tell me roughly about how many he has per week?
He hasn't had any changes in his bowel movements, I don't think. Right, Keith? You haven't had any changes?
Mm-mm.
No? Okay.
Keith, has it been hard for you to poop?
No, ma'am. I just kind of get shy when I go to the bathroom, but it's not much,
Latoya, why are you asking about his bowel movements? We are here today because Keith is wetting the bed.
Absolutely. So I'm asking about Keith's bowel movements because I'm concerned about constipation, which can lead to secondary enuresis.
Oh, okay. Thank you.
Of course. Keith, when you're in school, are you using the bathroom?
Yes, ma'am. I use the bathroom at school throughout the day. Sometimes I am afraid to go to the bathroom alone because of bullies, but other than that, I don't have any issues. Yeah.
Okay. Ms. Jenkins, has Keith been having accidents in the daytime?
I cannot remember the last time Keith had an accident in the daytime.
Keith, have you had any accidents?
No, I don't have accidents.
So oftentimes, parents can turn to Google. Have you tried anything at home to help with the bedwetting?
No, we have not attempted anything at home. We figured it was strange that Keith stopped wetting the bed and then he started again. Well, John, Keith's father, sometimes makes him do push-ups in the morning when he wets the bed.
And he puts me in time out and he yells at me and I get sad and I go to school upset. And my friend Adam always asks me what's wrong in the morning. And I'm like embarrassed to tell him that I wet the bed, but I'm also embarrassed to tell him that why my dad's really upset with me.
So I'm hearing John blames Keith when he wets the bed?
Yes.
Ms. Jenkins, please have a talk with your husband regarding the punishments. There are many causes for bedwetting, and studies have proven that the additional stress of punishment makes the bedwetting worse.
Interesting. I will talk to him and I will ensure that we are not blaming Keith for wetting the bed. But is this Regine's fault since this started when she came home?
Definitely, the stress of a new baby could cause this. Can you describe how much fluid Keith drinks? Does he drink a lot of soda or caffeinated products?
He doesn't really drink any soda or any caffeine. He drinks some juices and he typically drinks throughout the day. He doesn't really complain that he's thirsty.
Okay. Has there been an increase in urination throughout the day or any weight loss?
No.
So I understand. And I would like to reassure you both that this is not abnormal. Enuresis is more common in boys and more common in obese children. The doctor will further assess Keith and may ask similar questions. He will also order a glucose test and a urine analysis. And remember to not blame Keith, and the fluid restriction has not been proven to help. So the number one solution has been to set a bed alarm. Do either of you have any further questions?
No, ma'am.
I don't think so. I just feel so much better that it's not the diabetes and that it self-resolves.
Keith did not experience bedwetting?
Yes, ma'am. I was waking up in the dry bed. What?
Yes, ma'am. I was waking up in a dry bed. That's what you were trying to
I was
say.
waking up in a dry bed.
Keith is so southern.
I'm
I love it.
I'm done.
I love it.
I cannot remember the last time Keith had an accident in the daytime. He's been pretty good.
Keith, have you had any accidents?
No, ma'am.
Okay.
I cannot.
Okay. I swear I thought I was writing more for myself.
Oh my god.
All right.
John, Keith's father, sometimes makes him do push-ups in the morning when he wets the bed.
And he puts me in timeout.
Come in.
Good afternoon, Miss Jenkins and Keith. My name is Latoya, and I'll be your nurse today.
Latoya.
How are you going?
Seriously?
Deanna,
I'm